Hey, I just wanted to come on. I'm Dr. Delicia. Wanted to come on. I just wrapped up talking to a group of physicians and patients online, and we had some good discussions. So I wanted to come on and just share some things that you can do to prepare for your doctor's visit in the age of COVID-19, because it is definitely not business as usual for any of us, and you can make sure that your visit is better if you're prepared. So that's what I just wanted to come on and share. The most important thing is communication. So, both on the physician side, I've been sending a lot of emails to patients so that they know what to expect when they come to the office, because things are a little bit different right now. So we've been sending them, hey, Dr. Kalani, been sending a lot of messages to patients so they know what to expect. But also when you go to other doctors' offices, it's important to know what to expect. So first, please do not walk into a doctor's office and cough all over the receptionist and say you're there to get COVID-19 testing. Okay? We know that you're frightened, that you feel bad, and that you just want to get care. But and we want to help you. We definitely want to heal people. That's why we went into this profession. But we have to do it in a way that we can protect our other patients, so our patients that many of whom are immunocompromised, and protect our staff as well. So please don't just walk into a doctor's office and cough and say that you want to get tested for COVID-19. When by doing that, you can put a lot of people at risk, and the entire office could be shut down for 14 days and not be able to really take care of many people in the way that they usually would be able to take care of. And most offices don't have sufficient test kits anyway. So, we did some testing at our office this week in the parking lot, testing individuals, really high-risk individuals who were symptomatic, who worked in healthcare, who are at a really high risk of spreading the infection if they didn't know where to go to work that way. And either way, we were still telling them to quarantine. But a lot of offices don't have test kits. So make sure that you call ahead. So that's like the most important thing. The number one thing you can do to make sure that you're prepared for your doctor's visit is to call ahead. Find out if there's been any changes to their procedures and how they do things. So I spoke with a lot of specialists, and here in town, a lot of specialists who are in kind of larger buildings. They're taking temperatures outside before people even come into the office. So you can expect to see things like that, where they might be taking your temperature before you come in. A lot of people, we're really trying to keep people out of the waiting room. So we don't want you sitting in a waiting room with other people. Now, at my office, I'm a direct primary care physician. We're a very, pretty, low volume. So we never have people waiting in the waiting room anyway. But at a lot of offices, they're busier, and they typically would have a lot of people in the waiting room. So they're making changes to keep that from happening. So call ahead to find out about those. Some of the things that you may notice at some places, they'll have you wait in your car. And just, when you get there, you call from your car to let them know that you've arrived, and they have you wait in your car until there's room available so they can bring you straight back and not have you exposed in the waiting room or in other areas. And the only way that you'll find that out is if you call ahead and you'll find out how they're changing things. So those are some things that you may have noticed. And in our office, again, most of our appointment times are 30 minutes to an hour long, so we don't have a lot of people in the office at one time. But because we are such a relationship-based office, we can be pretty chatty because we want to catch up with everything that's going on. But we also want to make sure that, especially for our patients who are immunocompromised, that we are decreasing the risk for exposure. So we as well will have people come and have them park and call us, let us know that they've arrived, so that we can escort them in and just decrease their exposure overall. Usually people kind of come to our office and they start, they have the complimentary coffee and they're kind of chatting, and we usually love that. But during this time, we actually want to make sure that we're not having too many bodies in the office at one time. So again, call ahead to make sure you've seen if there's any changes. Make sure you call ahead about kids. So a lot of parents will bring their kids to their appointment. Sometimes they'll leave the older children in the waiting room while they go back. And so that may not be something that the office can do anymore. So make sure that you call and you ask about that. And this is slightly off topic, but I wanted to mention any way is service animals. So if you have a service animal and you're bringing them to your doctor's appointment, make sure that you call the office ahead of time to let them know about that. We've got patients that are severely allergic, and we want to make sure that we are scheduling people appropriately. So that really didn't go with this talk, but it just came to mind. So again, the first thing is to call ahead to see if there's been any changes to office procedures. The second thing I want to know about preparing for visits in the age of COVID-19 is to expect more telemedicine and virtual appointments. So if you are a member, if you're a member of a direct primary care office, this is nothing new. Most direct primary care clinics, we're all membership based. So our patients get things like same or next day appointments, longer run-on time with the doctor, and virtual visits included in their membership. But you'll notice that even within the DPC community and in other clinics that they're going more to telemedicine. That is one way of really decreasing exposures, and that's really all I did today was telemedicine visits. Not every single visit really lends itself to them, but a lot of them can. And so you may notice that there's a lot more doctors' offices doing telemedicine visits, and especially for those offices that don't have sufficient PPE. So if you don't have the personal protective equipment to be able to protect yourself, then you have to find other ways to practice medicine, because it's, and there was a report tonight that we've lost over 45 Italian physicians to this disease. So I just really implore physicians and health professionals to protect yourself. We went into this profession to take care of people. Our heart is in it. We're used to kind of running straight into the room when there is an emergency, but during this time, we need your heart, we need your mind, we need your skills. We don't need to lose you to quarantine, and we definitely don't need to lose you. So make sure that you take care of yourself. And if you work for an institution that isn't providing protective equipment, find a way to bring your own. And I know that that's against the rules at a lot of different institutions, but if they're not providing it for you, then it's imperative that you find a way to protect yourself. As the founder and CEO of Family First Health Center, it is my responsibility to make sure that I create an environment where my staff feels safe. And so before we started testing, I made sure that we had the protective equipment, and we didn't get it through our usual channels. So we didn't get it from our vendors. We actually, one of them came from a construction entity that works with us, and they do a lot of insulation, and they gave us the N95 masks, and our gowns came from a dental office. So if I had waited for my usual vendors to send me the equipment, I'd still be waiting. But I wanted to make sure that my entire team was taken care of. So it's, you may have to go outside of the usual lanes to get what you need, and just, make sure you do that. And to, my colleagues, one of them who was sharing today that her administration was threatening to fire people who brought in their own personal protective equipment from home. I think any administrator that has the gall to even, suggest that is, I just don't even know what they're thinking. So, bottom line, we need you. We need your skill. We need your mind. We need you to be protected. So make sure that you're protected by any means necessary. And again, as the CEO of my company, I made sure that all of my employees have protective gear, and we didn't start testing until we had that. And we've made a lot of changes in the clinic to really make sure that I'm protecting my patients, and I'm also protecting my team. Some of you may know I used to be a designer. I used to design offices, and we've really gotten away from the glass window, and I still hate the little glass windows, especially the ones that are frosted, that are always closed. But when I designed my office, I did make sure that we had a really large glass window that we could open. And in the past 10 years, that glass has never been closed until this week. So this week, because I wanted to make sure that my receptionist, when she's sitting there and people are coming in and they're, just, talking to her directly, that, that she's protected. And we didn't want people to come in and just cough all over her. Well-meaning people, like they weren't, coming in purposely to do that. They just felt bad and they know we're a doctor's office. And so they were just coming in with their symptoms. But I actually had her keep the glass closed because, although she does have a mask, she doesn't sit there with the mask the entire time. We have the window closed as another way of protection, and it's clear and it is big, and her smile still lights up the room. But it's just a different thing that we are doing to protect both ourselves and to protect our other patients. So that was a little bit of went off a little bit there, but do expect more telemedicine and virtual visits. I do have to thank all of the companies who have already gone out of their way to, without anything from the government, just, creating and helping out. So here in town, Fit USA, who usually makes sports equipment, they're now sewing masks, and no, they're not the N95 masks, but, they're working hard to create something. And then Copper Bottom Distillery actually, started making hand sanitizer, and have been doing it for, I think, over weeks now. So wanted to thank them. So we all can have a role to play. And so whatever your role is, and your most important role may be to just stay home and help decrease the spread in that way. But I just wanted to thank them. So number 2 was to expect more telemedicine and virtual visits. We're also doing curbside visits. So for some of my patients who have respiratory complaints, where I wouldn't want them to come into the clinic, but, I do a virtual visit and I just really need to lay eyes on them. I really need to listen to their lungs. I'll actually have them come to the parking lot and I'll just meet them outside and examine them there to, again, decrease exposure, but still make sure the patients are getting the care that they need. So just make sure, things are going to be a little bit different than what you might be used to. So call ahead to find out. So that was number 2. The third one is to expect screening questions. So no matter where you go, they're going to ask you if you have a fever, if you have a temperature over 100.4, if you have a cough. So expect that you're going to be asked those screening questions. When we have someone who tests positive for any of those screening questions, they immediately are going to get a telemedicine visit first, because again, we don't want them to just walk into the office and potentially expose other patients. So expect to be, having those questions asked, even if it's not what you're coming in for. So, every last one of our patients, whether you're coming in to get your labs drawn, or you're having a weight management appointment, every single person that's coming through that door is getting asked those screening questions, because we want to make sure that we know. So definitely expect that. Number 4 is to maybe expect your doctor to have changed attire. So most of us are in scrubs right now. A lot of us are used to, I actually usually dress nice for clinic, but not the past 2 weeks. The past, I've been in scrubs, and when I come home and I come through the garage, all that goes straight into the wash. So it's a small thing, but just something to expect that you may see that. And you also might see a lot of protective equipment. So your physician who usually doesn't wear goggles and a mask and gloves, may be wearing those things, specifically if you're coming in with respiratory complaints. So be aware of that. If you have kids, it's a good idea to show them pictures of health professionals in that protective gear before they come, so that they don't get as kind of frightened when they see us. It's one of the reasons that firefighters and police officers are really good about going into the community and having kids come up to them when they're wearing their full protective attire, because they want to make sure that the kids are comfortable with them, so that when there is an event and there is an emergency, the child doesn't run away. So it's a good idea to make sure that you go ahead and show them pictures and things before they come to the office. And we walk in with gloves and goggles and all of that. So definitely expect us to look a little bit differently. So those are the main 4. And then the 5th one I just wanted to share is that it's really important to have a primary care doctor. So we live in a land of urgent cares, and it's great to have that kind of access and to have care when you need it, but there is really nothing that replaces having a relationship with your own doctor, a good and caring family doctor. So there are a lot of doctors that are still accepting new patients. There are a lot of doctors who participate in direct primary care, which is a style of medicine that I practice. So definitely, if you're in the Volusia County area, we would love to take care of you. You can go to familyfirsthealthcenter.com to find out more information there. And if you're not, there is a website called DPC Frontier that you can go to, and you can look at your state and see if there's any of these more relationship-based clinics near you called direct primary care. So you can go there and find out if there is a doctor near you that would be able to provide that type of care. So that's what I wanted to share again, was just, some things that you can do to prepare for your doctor's visit in the age of COVID-19. So the first one would definitely call ahead to make sure there aren't any changes to procedures. It's not business as usual, so there definitely will be some, and the more you're prepared, the less you'll be frustrated, and you'll know what to expect. The second one, again, was to expect more virtual visits, more telemedicine visits. All of my patients got emails, so they know how they can schedule directly for a telemedicine visit with us. And if you didn't, make sure you check your spam. But hopefully you did. And the third one is to expect those screening questions. So everyone is going to be asking and wanting to make sure that, if you're symptomatic, that they're catching that. The fourth one was, again, just to expect that your health professional might not look the way they usually do. So a lot of people are going to be in scrubs. A lot of people are going to be wearing some protective equipment, and that's really important. If you know someone who has protective equipment, who can, help out health professionals, please do. We are definitely putting our lives on the line every day to protect yours, and we went into this profession to help people, but we also want to, be there for our own families and maintain our own health. So it's definitely an important thing, and I appreciate all of the companies and everyone who's been helping. I have to really thank the dental office and the construction office who helped my team out, and we didn't even know to ask them, but they just said, hey, we want to make sure you guys are around, take care of us, so here you go. So we appreciate that. Again, that was number 4, was expect change attire. And then that last one that is so important is to really make sure that you have a relationship with your doctor. There is just nothing that gives more peace of mind than the ability to literally pick up the phone and call your doctor and get your questions answered. I feel like what I've done most today is just really give people peace of mind. And when I was talking to my partner, Dr. Kim, that she's been doing the same thing as well. So that's it. I hope that was helpful for you. Again, I'm Dr. Delicia Haynes. I'm the founder and CEO of Family First Health Center, award-winning entrepreneur and pioneer in the direct primary care space here in Volusia County. If you are here locally in this area, we would love to take care of you. So you can look us up at familyfirsthealthcenter.com. You can follow me across social media at Dr. Delicia MD. That's DRDELICIA MD. And again, I hope you guys all stay healthy. Take care.